Regular checkups can play an important role in the overall health and increase the quality of life, which cannot be ignored to improve the standard of living. In this video, I am going to talk about which checkups we should do. Mammography. The American Cancer Society recommends that regular breast cancer screening should begin at 45 years of age. But if you have a history of breast cancer in your family, mammography should be done at a younger age according to your doctor's diagnosis. And the best time for mammography is the first day of menstruation, PSA, the most common method and laboratory test to diagnose prostate problems. All men from the age of 50 should do prostate monitoring, and if there is a family history of prostate cancer, it's recommended to do checkups and tests from the age of 45. Intense physical activity and sexual intercourse cause a false increase in PSA up to 48 hours. Blood pressure. Regardless of your age and gender, if you do not know your blood pressure range, measure your blood pressure within the next few days. To do this, you can go to health centers and clinics or use home blood pressure devices. Urinary function tests. One of the most common human infections that does not have any symptoms at the beginning of the disease, but if it's not diagnosed and treated in time, it will lead to urinary tract infections. What symptoms do you need to get tested? Urinary discharge with burning or pain, feeling of bladder fullness, but when emptying, a small amount of urine leaves the body, blood in the urine, and pain in the lower abdomen and sides. CBC. One of the most important tests is CBC checkups. A CBC includes a complete blood cell count that is used to detect abnormal cells, infection, anemia, inflammation, leukemia, and immune system disorders. Fatty liver, another silent disease which is the most common disease of the digestive system. For the initial diagnosis of fatty liver disease, liver function tests are recommended. I suggest that along with liver function tests, blood sugar and blood lipids should also be checked. Liver function tests do not require fasting. Important points. Request to perform all the mentioned tests and interpret them under the supervision of your doctor. If you are under 50 years old and do not suffer from chronic diseases, do the necessary checkups at least once every 3 years. Pap smear and measurement of vitamin D level are also important checkups. Always and always, since the beginning of history, prevention is thousands of steps ahead of treatment, and that's why we emphasize on regular annual checkups.